Lindsay.
Hi.
My name's Aleah. I'm a physical therapist. I'll be working with you today.
Okay.
So you're coming in for your neck?
Yeah. I've been having a lot of pain in my neck. And yeah, so I went to the doctor this week and I got an MRI and this is what it came out with. It shows that I have like degenerative disc disease.
Mm-hmm.
And I think that's what's been causing all my pain in my neck.
Okay. So after looking at your MRI, I'm seeing mild disc degeneration. So last week, if you remember, we went ahead and manipulated your neck, and you were having, a lot of pain, just even with me touching it. 7 out of 10 was what you were saying. And that doesn't really go along with what I'm seeing here, the amount of damage you're showing. Disc degeneration is actually very normal for people as they age. Most people have it, but most people don't feel the way you do. Most people don't have this much pain. But this is a normal aging process, and it's not going to be limiting you from, doing all of your activities and working and living your life. I think you've got something else kind of going on here besides, I think your discs are actually okay.
So what's going on?
So I think what's going on here is you have some oversensitization of your nerves.
Okay, what does that mean?
So what can happen is in situations where you've had some sort of trauma or some sort of distress to the tissue, what normally happens is, you have a trauma, you relay that trauma to the brain, and then you feel pain as a result.
Okay.
If you've had that happen before, sometimes what can happen, it's kind of like a house that's been broken into.
Okay.
So, the first time the house gets broken into, there's a robber, and the alarm goes off, and that's absolutely what needs to happen. You've got this trauma and damage, but over time, after you've had that happen, you can get an alarm that's overly sensitive. So you can just have like a leaf blowing in your front yard, and you experience all this pain and all this perceived damage that isn't really there.
Okay.
So what we need to do is we can do some therapy to try and reduce that sensitization of those nerves that you're feeling. And some things, there's actually other things that can kind of make that worse and exacerbate that pain you're feeling.
Mm-hmm.
It's not just the nerves. It can also be if you're feeling stressed or you're having some difficult stuff going on in your life, which you said last time you are,
yeah.
right?
Yeah, I think I told you I live with my grandma. She's not doing well, and I'm not doing well. We're not able to take care of each other. It's been really hard.
Yeah, that absolutely would make that feel worse for you. And so I think if you're open to it, something outside of the clinic that we could do that in conjunction with what we're doing here was possibly talk to a counselor to try and help you with the stress you're experiencing. Is that something you might be open to?
Yeah.
Oh, awesome. Okay, so I'm going to refer you to a really great counselor, and we're going to work on that, and we're going to work here, and we're going to get this better. We're going to improve on this.
Awesome.
Yeah.
Thank you.
Great. Okay.